shit. Are we waiting for a couple more people or?
There's Darcy. Welcome, Darcy.
Good morning. Is it my turn? Sorry, my mic is working here.
Yeah.
Yes.
Carrie, have we started?
Yes, we have. We've called to order. You bet, Darcy.
Thanks, Carrie. This is Sarah Polachek. I'm the Communications Coordinator for the Health Region. I'm here to assist today as the moderator. After today's presentation, audience members will have the opportunity to ask questions. Please email any of your questions to nhrcommunications@nrha.ca. I would like to now introduce Melvin Contois, who is the Elder and Knowledge Keeper for the St. Anthony's Hospital in the PAW. Melvin?
Hi, my name is Melvin Contois. I'm Indigenous Keeper for Norman region. And whenever you want the prayer, I will say it in my language. Did you want me to say it now or wait?
Sure.
Okay.
Thanks, Melvin.
Yeah. Ai, timi get mo tai ta pe mama pe tigo tawista anishinyo mo ta mantumenan. Ma kawista tai panik. A pe tigo to mai tradition tagi Cristo kaus aviti to check kana ta ka ko nimit tigo ta ma. Mo ta pe emia mo ta im ka veones ka ya mina sepa ya mantumenan. Amigets. Amen.
Thank you so much, Melvin. I would like to now introduce Diane Russell, the Board Vice Chair, to provide today's land acknowledgement. And I'd like to apologize for my microphone difficulties.
Thanks, Darcy. The Northern Regional Health Authority acknowledges that we are situated on Treaty 5, 6, and 10 territory, and that Manitoba is located on the traditional and ancestral lands of the Anishinaabe, Anananu, Desolin, Nathawak, Inanakwak, and Nehiyawak nations. We acknowledge that Manitoba is situated on the homeland of the Red River Métis. We respect waters, land, histories, language, and cultures of First Nations, Métis, and Inuit, whose presence enriches Canadian society. We respect and acknowledge that we are all connected through the spirit and intent of treaties and treaty making, and remain committed to working in collaboration and partnership that will encompass equity, justice, truth, and reconciliation. The term Indigenous means First Nations, Métis, and Inuit inclusively. We acknowledge the unique status of Indigenous peoples in Manitoba and Canada.
Thank you, Diane. The agenda for today's meeting, I have a motion from Diane Russell, seconded by Linda Marcus, that the board approve the agenda of the 2023-24 Annual General Meeting of the Northern Regional Health Authority. Are there any board members who are opposed? Hearing none, the motion is carried. It is my pleasure to introduce you to the Northern Health Region board members. I myself am in the role of the board chair residing in the PAW. Diane Russell, Vice Chair, Flin Flon. Linda Marcus, board member and chair of the Indigenous Health and Human Resources Committee, residing in Thompson. Bruce Fiddler, board member from Creighton, Saskatchewan. Tara Monroe Manich, board member and chair of the Governance Committee, residing in the PAW. Angela Onright, board member and chair of the Quality and Patient Safety Committee, residing in Snow Lake. Kathy Valentino, board member and chair of the Finance Committee, residing in Thompson. Jim Berscheid, board member and chair of the Audit Committee, residing in the PAW. Ashley Sweeney, board member residing in Thompson. And Lynn Zapshala Kelm, residing in Winnipeg. Our board of directors met for 10 regular meetings throughout the fiscal year of 2023-24 in a blend of virtual and personal meetings. Continued collaboration with the Ministry of Health. Listening tour came to Thompson this August to hear from frontline healthcare workers. New capital projects include the announcement of a new mobile MRI in the north, which will offer thousands of MRI appointments closer to home. A board retreat was held last October and focused on the new strategic priorities. As board chair, I've had the opportunity to join engagements with the Minister of Health to bring focus to the priorities of the province. The board completed a tour of the Thompson General Hospital to have a realistic viewpoint of the master planning underway for future expanded service delivery. The board has been very excited to see the Indigenous Health Department expand in roles and integration into our organization. Development is also underway of the Region's Wisdom Council. The board continued building relationships within the region, within the province, and also with our neighboring province of Saskatchewan. The board wants to extend their appreciation and dedication to the entire staff for their continued commitment and support to the patients they serve. The North is the largest regional health authority in Manitoba. Geographically speaking, with the smallest population compared to all regional health authorities in Manitoba. Our region has 1,647 staff, not including the many important shared health staff that work within and closely with our facilities and programs. We have 6 acute care sites with a total of 91 active acute care beds. We have 4 long-term care sites with a total of 161 long-term care beds, 4 primary care clinics, and 6 active emergency departments. A note of accomplishment and recognition to our leadership team, who has kept all 6 active emergency departments open 24/7 without any interruptions in that schedule over the past fiscal year. I will now introduce Rod Suda, CEO of the Northern Health Region, to speak to the provincial priorities.
Thank you, Carrie. Now I would like to take this moment to highlight how the Northern Health Region strived to achieve the strategic goals and priorities in the past year. As you can see on the slide here, during the past fiscal year, we received a high-level system strategy from Manitoba Health, Seniors and Long-Term Care. This identifies the immediate priorities from a provincial level that we as a health system are working towards. As you can see, these 5 priorities, which are on the right side of the arrows, are aligned with the 4 priorities of the Northern Health Region as identified in our current strategic plan. I will now highlight accomplishments from each of our priorities. Priority 1, eliminating Indigenous specific racism. This has been one of the most crucial aspects of our service delivery over the past year. We have strived towards this priority by recruiting and implementing several roles, as an example, elder or knowledge keeper roles, Indigenous culture facilitator roles in long-term care facilities, and regional dietitian Indigenous focused roles in our long-term care facilities as well. We strived to build cultural proficiency amongst our staff with mandatory education, and we were successful in implementing the policy that addresses Indigenous specific racism. This policy will help us as an entity to process, highlight, and work towards eliminating Indigenous specific racism, and will also help our patients, members of the public, and staff to report incidents of racism. In addition, the Northern Collaborative working team, which we usually refer as NCWT, served as the steering committee for the Northern Provincial Initiatives. This NCWT team represents Indigenous communities across the North, and it comprised of dedicated health leaders, and these leaders played a pivotal role in guiding and directing provincial clinical planning, ensuring that the work aligns with the unique needs and priorities of the communities we serve. During the year, the NCWT made significant strides in advancing awareness and advocating for the healthcare of Northern and Indigenous communities. Priority number 2, provide a positive patient experience. We exist for our patients, and we achieve this mandate or this priority in several ways. Our patient experience data continues to inform our leaders where opportunities for improvements exist in patient care delivery. The most common theme that you as the public have brought forward to us is that there are delays in access in primary care services. This topic almost represented about 27% of our complaints, which in numbers equals to about 105 complaints. In response to this, we partnered with QDoc for an additional option to provide virtual healthcare. We also continued to provide phone appointments through primary care providers when appropriate. And at the same time, we were able to open the community care clinic in the Thompson General Hospital. Priority number 3, healthy workforce. Vacancies are challenging for operators in the North, and we're part of one of such organizations where we strive hard to fill our vacancies. By filling vacant positions, we can provide better work-life balance achieved for many healthcare staff. And we were able to achieve these through several initiatives. We increased engagement with our community through our annual trade shows. We were able to collaborate with local educational institutions. For example, we signed a memorandum of understanding with the Northlands College in Creighton. We increased our clinical care assistant roles as part of the interdisciplinary team. We leveraged the provincial float pool for more nursing resources. And we continue to work hard, helping our teams not go burdened with the vacancies in the areas of their practice. Priority number 4, we strive to be a sustainable and adaptable organization. And this was achieved through several initiatives over the past year. One of the key initiatives is our work towards achieving a mobile MRI for the North. We were also able to have our community care clinic function optimally with ambulatory care and nurse practitioner roles. This clinic helps to improve our emergency department wait times in the Thompson General Hospital. Our public health continues to work hard in delivering immunizations, screening, and health education activities. We also expanded our surgical services in Thompson for ear, nose, and throat, pediatric dental, general surgeries, and endoscopy services. We continue to enhance our virtual healthcare partnership to increase access to primary care. Another angle to review the topic of improving access to primary care and avoid delays is to review this data from emergency departments. On the Canadian Triage and Acuity Scale, which we usually refer to as CTAS, CTAS acronym, the score of 1 is most immediate needed help, to score of 5, which is a non-urgent. So as you can see through the data, our numbers are quite high for CTAS scores 4 and 5. What it means is our emergency departments are seeing patients who could have been helped in their primary care clinic or with a family care provider. This is a priority for our leadership. We will attempt to redirect or gain more resources in our primary care clinics so that you as our patients are not waiting in the emergency department for the care that you could have sought help elsewhere. Some of the regional highlights that as the leader of NHR, I'm proud to share with you. Over the past year, we saw total emergency department visits of 69,074. It is noteworthy that we serve a population of 76,000 in the north. The total dialysis treatments that we were able to provide to our clients were about 10,582. Total medical unit admissions were around 2,251. Our region completed about 2,006 surgical procedures on an outpatient basis, and about 931 newborn babies chose us to be the provider of their care. And total specialized care unit admissions were about 212.
Thank you so much, Raj. I would now like to introduce you to Kathy Valentino, our Finance Committee Chair of the Board, to speak to our financial statement highlights.
Thank you, Darcy. Thank you, Raj. I'm going to take you briefly through our audited financial statements. Our auditors, who are MNP, they are a leading national accounting, tax, and business consulting firm in Canada, and they are independent of our management and our board. So for 2023-2024 audit, we have again received what is known as a clean opinion from our auditors. And you can see that that's identified in the actual statement above from the auditors on our financial statements. I'm going to move a little bit now to the corporate administration costs. So you can see on this slide, we've compared from 2022-2023 and then 2023 to 2024 for your information. So all of our regional health authorities have to provide transparency as to what is included in this nationally accepted definition of administration costs. So the administration costs are broken down then into 3 categories, and those are corporate, patient care related, and human resources and recruitment categories. These 3 categories then are to be reported as a % of our total operating expenses in regional health authority annual reports. And that's what you see above. So the figures presented are based on data available at the time of the publication. And the administrative costs, the percentage is the percentage of total spending indicator. So the administrative costs are a percentage of the total operating costs on the chart. And this is how we have to do it because it adheres to the Canadian Institute for Health Information Definitions.
Right. Okay. Thank you, Kathy. I will now ask Sean Knighty, VP of Corporate Services and Chief Financial Officer, to go over the revenue and expenses.
Sean, can you unmute on your end?
Help a lot, wouldn't it? My apologies. But as you can see, the 2023-24 financial results are posted for your viewing in the millions of dollars. Roughly 90 2% of our revenue comes from the province of Manitoba at $257.5 million. $8.7 million is NPTP recoveries. So what that is those are basically when we third-party invoice for services that are provided through our Northern Patient Transportation Program. $6.3 million is revenue received when recipients do not have insurance or health coverage in Manitoba, or even when their coverage is provided by a third party, such as an insurance company, and that is $6.3 million. Personal care home is the revenue received from our residents residing in the personal care homes of $4.1 million. Federal government is money received primarily through Indigenous Services Canada for services we provide to First Nations patients residing in the Northern Health Region. There was a bit of an increase in funding, as you can see there, for services to provide into the Northern Health Region. So we're up to $2.1 million. And patient income is coming in at around 300,000, which is just, other income that from various goods and services that we are able to gather through general operations. I can now move on to expenses. As you can see, our expenses have significant disparity in volumes, with acute care being by far and away the largest expenditure of monies within the Northern Regional Health Authority. And that department or that portfolio would include all hospital operations, and any medical administration that does not fall under the medical remuneration listed below. So medical remuneration is specific to the salaries and wages that we pay to our physicians providing service within the North. The Northern Patient Transportation is comprised of two areas of expenditures. Most commonly, the residents in the North know of the subsidy program, whereby approved services outside of our region are allowed to receive certain subsidy amounts for travel to obtain the services outside of the Northern Health Region. And the much larger component of this is comprised of a basic air ambulance, which is for emergent services in air flights to basically primarily to Winnipeg from the Northern Health Region. That is one of our largest expenses that is continually growing year over year, and is one of the areas we are striving to work with our partners in the Department of Health, Shared Health, to see if we can work towards some improvements in that area. Community-based or public health are all of those services that our staff go out into the community to provide, both for public health services as well as community and mental health services. And then long-term care, aging in place, is about meeting the needs of our aging population in all of the various services and care homes throughout the Northern Health Region. So as you can see, expenses have risen significantly from 2022, 2023, up about $21 million. I can now hand it all back over to Raj. Thank you.
Thank you, Sean. It gives me immense pleasure to share that our annual report for 2023-24 is now available on our website. Please visit our website, northernhealthregion.com, and to click and view this very informative document. And if you're interested in further details on these topics, this is a document that we would like you to read and familiarize yourself with. And with that, I would like to thank all the attending members for this presentation today.
We've now reached our question and answer portion of the program, and I'll turn it over to Darcy Thompson, our moderator for today.
Thank you, Carrie. Again, there is still some time, so if you have a question, please send it in to nhrcommunications@nrha.ca. It's at the bottom of your screen there. If we do not get to your question, or if you have a question that you don't want read aloud, you can have a written response sent back to you via email. So a bit of time here if you would like to send in a question. Once again, you're able to submit all your questions to the nhrcommunications@nrha.ca if we haven't read or gotten to any questions today. So for now, back over to you, Carrie, as we've had none come in.
Okay, thank you, Darcy. This concludes our AGM. I will now adjourn the Northern Health Region's 2023-2024 Annual General Meeting at 12:27 p.m. Thank you, everyone, for attending today. And remember, every vaccine counts, so be sure to get your flu shot this season. You'll find all the dates for clinics offered on our website. And thank you so much for joining us today.